Now, this is a lady who's 5 years post motor vehicle accident. And one of the things is that with the lawyers, they were litigating against the motorist who had hit her. And she was supposed to write a victim impact statement, and it had been most of a year now, and she still hadn't written a title. After 3 weeks of entrainment using SMR beta, she wrote a 15-page report. So very impressive how her brain kicked back into service. And we can see here some of the things she reported. Difficulty remembering things, focusing and concentrating, reading. I could not easily distinguish between right and left, and I had balance issues. I was also having strange things happening with my vision, where there was a delay in seeing things. Because of my disabilities, I was unable to work, and that causes stress too. I mean, when now people have money issues, right? And that causes a great deal of stress and interferes with sleep when you cannot pay the rent or pay the mortgage or buy groceries. And what we find and what we believe is that the more psychiatric disorders or a person has, the more they struggle financially because they can't work and they can't budget their money well. And also, say, as obsessive compulsive people, they may spend money recklessly at times as well. And these are all factors, but they certainly do struggle with money. So a technique that is very low cost, easy to implement, and can be used at home and empowers the client to heal themselves is the best approach you could ever imagine for people in these situations. Anyway, back on track here. She also had issues bumping into everything and dropping things. She had poor sleep, which everyone has, and very focused on pain issues with her body, which resolved completely a few weeks after entrainment. A lot of her pain was because of the fact that she was obsessing on it. Now, look at her record here again. Again, very low voltage, choppy looking stuff. T3 and T4 have a little bit of muscle that got in, and she's blinking her eyes a lot. She can't seem to stop this tick that's in her eye. That's related to anxiety. It's an anxiety tick. And you can see it on the top records, FP1, FP2, F7, F8, and these little ticks are showing up from her eyes ticking away. Look at her now on the raw scale again, and look at 1.75 microvolts, again, very low voltage. And guess what? 5, 6, 7 hertz, even 4 if we zoom out a little. This is all slow activity, and the locus or the center point is down the cingulate, and that's her OCD. On the database, and so now she's being z-scored against the normal population, we see that her alpha, again, is dropped out. She has next to no alpha to speak of, and that's why 10 hertz is so blue. The database is looking for that. Here's her phase. More left-right issues, which is more typical what we see. Some front-back stuff too, but more left-right. This is her beta phase, again, which has to do with cognition. And look how that's hammered out. It's really pounded out bad. A lot of issues, again, more to do with left rear, right side, and right side. The signals are very slowed in one direction. This here is roughly at about the 18-minute mark of entrainment. Although the recording, this segment of recording, I had restarted recording again. And this is one little over a minute into the recording where I took this sample, but I started this at about 15, 16 minutes in. And so roughly at 18 minutes, she's starting to show big, beautiful alpha spindles. And they're in the parietal area where they belong. That's where they should be. Not everybody always starts off that way. It kind of depends where their injuries are. But this is starting off really nice in the right area. And look at this now. This is now on the microvolt scale again. Beautiful peak at 10. That's what we want to see. And it's more in the parietal area on the back. A little bit in the occipital, but beautiful. Now take a look at it again, a few slides back. I feel like she's all dropped out here. So that's where we like to see it. And she's doing much better. Some of the entrainment at 20 hertz or so got into the record, and that's okay. And we don't mind that. A little of the SMR got in at 14 hertz as well. But her brain is much more smooth and normal than it was before. Phase improved tremendously. Remember the phase? Now, that's what the phase, what we saw there. And I don't know if I can always explain why the phase is doing so well, except that if we get the drummer going again, which is the alpha rhythm, it might be removing that randomized delta activity that's coming off of the Rich Club network. This is what she said when the session was over. This was on a Friday when we did the brain map and the entrainment. And she said she was clear-headed, sharp, really doing well, till about mid-Sunday. Then she started fogging back up again. So her brain started regressing back into the injured way of operating. So we got her back in the next week and sent her home with an audiovisual entrainment unit, the David Delight, and gave her an SMR beta protocol. She got a little too wound up on that protocol, she found, so later we put her on the brain brightening protocol, which is a protocol we use more with seniors with cognitive decline. And we've had some very good research on that. And that's what she liked best. Now, this is the SCL90 form again, but I didn't process it this time because I wanted you to see the actual issues she was having specific troubles with. And you'll always will see it's cognitive and it's emotional. So what is really highlighted here? What's really standing out? Trouble remembering things. Memory, cognitive, and emotional. High in feeling blocked and getting things done. High, having to do things very slowly to ensure correctness. Difficulty making decisions. Mind going blank. Trouble concentrating. Heavy feelings in her arms and legs, and that's pretty common. Awakening in the early morning. Well, they all have sleep disorders, so that's what they do. And so her score was a 72. This is her 3 weeks after using entrainment. Now her score is a 10. She has practically no issues to speak of at all. A little bit of trouble remembering things still, but it's still down from what it was. Here's the previous, prior to treatment, and here's 3 weeks later. Dramatic increases. In fact, she has gone to work and has a full-time job now and is doing very well. Here's another case.